A woman, 28 years old, first consultation on September 18, 1993. She had been married for 4 years and had not conceived. The male partner was normal. The patient had long-term soreness and pain in the lower back and knees and distension and pain in the lower abdomen, which worsened during menstruation. Menstrual flow was relatively heavy with a dark purplish color, and the menstrual cycle was prolonged. Vaginal discharge was profuse, sticky in texture, and yellow in color. The tongue body was dark purplish in color. The share tai appeared like a layer of mud and was yellow in color. The mai was rapid, thin, soft, and weak. The physician considered that there was excess heat and dampness in the body, which obstructed the movement of elements such as shui, resulting in infertility. Treatment should remove excess dampness and heat and unblock the stagnated shui. The physician prescribed a self-formulated prescription, Hongjiang Chuan Tong Tong, as follows. Red vine stem, 30 grams, Petrinia herb, 30 grams, quoich seed, 30 grams, dipsacus root, 20 grams, acuranthes root, 20 grams, salvia root, 20 grams, motherwort, 20 grams, spatholobus vine, 20 grams, giant knotweed rhizome, 10 grams, philodendron bark, 10 grams, atractylodes rhizome, 10 grams, cyperus rhizome, 10 grams, sparganium rhizome, 10 grams, zeduary rhizome, 10 grams, pangolin scales, 10 grams, gladitia spine, 10 grams, and liquid amber fruit, 10 grams. This was the daily dosage. All the medicinal materials were decocted together into a soup, and the decoction was taken in 3 divided doses within 1 day. After taking the decoction continuously for 2 months, all symptoms disappeared. The she tai returned to normal, and both menstruation and vaginal discharge normalized. The physician then modified the previous prescription by removing Huang Bai, Hu Zhang, Bai Jiang Chao, San Lung, A Zhu, Chuan Shan Jia, Zhao Jiao Si, and Lu Lu Tong, and added astragalus root, Huang Qi, 20 grams, and prepared Romania root, Shu Di, 20 grams, which the patient continued to take. 2 months later, the patient returned and reported that she had become pregnant. Notes: 1. She tai, a traditional Chinese medicine term referring to the substance covering the surface of the tongue. 2. She is a TCM term, is produced from extremely refined substances after being transformed by qi. It is responsible for nourishing and moistening the entire body, and it is also the material foundation for our mental and thought activities. She is different from blood. 3. Mic is a TCM term. It is the place where she is stored and circulates. In diagnosis, it specifically refers to the pulsation site at the wrist. 4. Qi is a TCM term for an extremely minute, highly vital substance that circulates constantly within the human body. This includes the qi of breathing. Qi drives and stimulates various physiological activities in the human body. The cessation of its movement signifies the end of life. Some substances in the human body are constantly present, yet invisible, and some even exist only when the human body is alive, such as the qi of breathing.